Give the call to the honourable member for Blair.
Thank you, Speaker. My question is to the Minister for Health. How are Medicare urgent care clinics helping Australians get urgent health care when they need it and helping ease pressure on hospital emergency departments? Why is this important after a decade of cuts and neglect?
Call to the Minister for Health and Aged Care.
Thank you, Speaker, and I thank the member for Blair for his question. He's such a strong advocate for better health care, better aged care in his Ipswich community, and a really strong supporter of the Ipswich Medicare Urgent Care Clinic that's been open for weeks now. There are now 38 clinics open and operating, with 58 to be open by the end of this year, Mr Speaker. They'll be operating 7 days a week, extended hours, open to walk-in patients who need urgent care for non-life-threatening emergencies, either for themselves or for their kids, Mr Speaker, like Billy and his mum, who went straight to the Ipswich clinic with a suspected broken wrist from playing basketball. 12-year-old Billy was triaged in just 5 minutes, Mr Speaker. He was seen shortly after by a doctor. He was then x-rayed, he was treated with a splint, and he was then connected for a physio appointment the following week, all done within 2 hours, Mr Speaker. Or Melissa, in the member for Lindsay's electorate, who took her daughter to the Penrith Urgent Care Clinic with a possible ankle fracture from playing soccer. She was seen, x-rayed and discharged with a cam boot in less than 1 hour, Mr Speaker. Melissa's mum said, and I quote, "Why would anyone go to the emergency department with this sort of injury when the Medicare Urgent Care Clinic can deal with it so quickly?" Mr Speaker, it's not just quickly. Importantly, these appointments are completely free of charge. They are fully bulk billed. All you need to do is take your Medicare card. So far, with the 60,000 occasions of service that have already been delivered, a third of them are for kids under the age of 15. A third of them are on the weekend, when often people can't get in to see their usual GP. And of the weekday services, fully 1 in 5 are after 6 p.m. And these are not just providing high-quality urgent care where and when people need it, completely free of charge. As the member for Blair said, it's also taking much-needed pressure off our overcrowded emergency department. As we know, Mr Speaker, almost half of presentations every year to our EDs are semi- or non-urgent presentations, so-called Category 4 or 5s. It's early days, Mr Speaker, but we know these clinics are already making a difference. The Logan Hospital in the Treasurer's electorate, Category 4 and 5 presentations have gone down by 10% since the Logan Medicare Urgent Care Clinic was open, compared to the July and August average. At the Ipswich Hospital, it's fully a 20% reduction in that type of presentation, a huge relief of pressure. This government was elected, Mr Speaker, to strengthen Medicare. We're delivering on that promise, tripling the bulk billing incentive, delivering cheaper medicines and rolling out a network of Medicare urgent care clinics.